Okay, we're back again after the break, and Sylvie is still here with us, and I really like her to tell you that because she had been receiving regularly calls saying that she doesn't go in for standard treatment, she's going to die. So I want her to tell you what's her point of view on that one. Okay, go ahead, Sylvie.
My point of view is that initially when you get a letter or a call or when you're told that, I guess it's a little bit scary, but I think when you go back to when you get out of the establishment and just give it a thought and realize the reality of things, then the fear goes away. And I guess basically when you've made a decision and you believe in what you've done, then you just stick to it and to keep your belief. And that's I think that's what keeps people strong too. I think stress and those other things and people that worry all the time are the ones that are going to end up going back to the doctors, going back for the mastectomy, and may or may not survive. That's what I believe on that. I mean, I'm not foolish enough to let myself die. I do get myself checked out. I've had a couple of MRIs, probably 3 since I've actually had, since 2 years ago, since October of 2008. And I've had a few ultrasounds. I've had 1 biopsy on the right side because they'd found a lump on my right side, and of course my doctor had me all panicked and said, this lump grew and it's huge and all this other stuff, and so my husband kind of pushed me to go for a biopsy, and so I thought, all right, I'll go, but I said, no, I think it's normal around my period that I just get lumpy, and sure enough, they couldn't even find it by the time it was, the day of the biopsy, so everything was fine, and it came out, it wasn't cancerous, so that worked out really great for me.
Well, it's pretty amazing, though, because I guess they're doing a better job than here in the U.S., because, you see, once it's dead, the way it's killed with hyperthermia, the biopsy will not be helpful at all, because the biopsy uses a microscope that is not powerful enough.
Yeah, well, that's on the right side. They won't even do the left breast, which I believe was the worst one, and they don't want to do a biopsy. And you know what? Honestly, I don't really want to go through that again.
Because they're going to tell you it's still cancer. Even though it's decomposed, they're still going to tell you it is cancer. That's what they do to most patients.
Oh, yeah, absolutely. Absolutely.
Yeah.
Yeah, and I think as long as I'm around, they're going to tell me that I'm going to die. But, it's like I say to them, well, we're all going to die someday. But I'm sure I'm going to outlive most of them, so I'm not very worried about it.
But at least, and also the point is doing in your own term, not being a zombie for months and suffering with the treatment. What kind of life is that? That is not offering life.
Oh, absolutely not a life. All my friends and family now, I believe the people that are very, very close to me really, truly now believe. Some of them were a little skeptical in the beginning, but now I see that they truly see me and that I'm healthy, and they've seen the results, and they've seen me go and take care of myself. And I know that should any of them be in my situation, they would follow in my footsteps and go to your clinic. I think they've really changed their way of thinking. It's more the strangers, the people that don't know you, that you talk to, that don't really, understand. Maybe it's a lack of understanding or just the fear, like you say, from the medical community. Yeah. But no, it is not a life, and it's a life that I refused and that I will always refuse to live.
The thing that was getting me... Yeah, go ahead.
No, go ahead.
No, it's just go ahead, because what I was saying is patients normally go through this stage that the immune system attacks the dead tissue and they try to remove some of the dead tissue slowly but surely over time. And that corresponds with the time where the area swells up and feels sore, hot, and tender. And you haven't had any of that. And so I was just wondering, of course, yours is kind of slow on being flushed out, but you haven't had any of that. And I was just wondering why. And then you told me. So I thought you should tell everybody that so people that listen to it, maybe they'll also hear it from somebody else and they'll follow your example. Go ahead. Okay,
yeah, for the swelling and inflammation, I guess, like I said, I've done a lot of research and I do read, and I'm on the Internet all the time. And I guess what I found out was it's a natural spice. I take curcumin, a lot of curcumin, which is from the turmeric spice, and it's just a natural spice, but apparently it's more powerful than any prescribed anti-inflammatory. And as well as sometimes I'll drink some green tea, but you know they're just little things that I take that probably.
How much of turmeric do you take?
In quantity, well, I take 4 little tablets. I don't take them every single day, but a couple times a week with a meal.
Okay.
And you're supposed to have a little bit of pepper. Apparently, it makes it like 1,000 times more effective. But it's just very, very good for any inflammation, whether you have arthritis but that's another show. I don't have arthritis, but
that's okay.
That's another show.
And with that, you're probably not going to get it. You know, if you're taking that, you probably
Exactly, yeah.
Yeah, but you see, that's
the thing. What I've done, and my God, I just, I admire you. I mean, I go on your site and I see your battles and I see what people are trying to do to you, and it's just so upsetting. And, you know, sometimes I just want to sell my shop. This is so important. And I don't think the world realizes that this is out there for everyone. It's not available just to some, to a few. It's available out there for anybody that will listen or anybody that will take the time. And I know that it's very, very difficult when you're told that you have cancer to start looking at alternatives, because people don't even have the mindset that there may be an alternative. Maybe the cures are already out there, and after this experience, I'm almost convinced that there's a cure for everything out there, and it's just not out there. You know, nobody's going to tell you that it's out there because, like you say, the establishments that be, the powers that be, that are going to lose all these billions of dollars, and I discovered that a long time ago, and it's very unfortunate. My God, I have begged some people to listen to me, to go. I have written to every establishment. I've written to the Sue Komen Foundation. I've written to Oprah. I've written to Dr. Oz. You name it. I've sent my story everywhere, hoping that somebody would listen, somebody, you know, that has some kind of influence, that would listen to me, and that somebody would go to your clinic and work along with you to help others or to encourage. And I think someday when enough people yell and scream and say, hey, I'm cured, there's another way out there, the people that will keep talking, eventually people will start to listen. You know, eventually people that see me around in 30, 40, 50 years, still full of life and cancer-free.
Yeah, well, I'm not going to be around that long. I am not.
Exactly. So maybe I should go down there and help you out. You could teach me the ropes.
But you know, it's just awful. But you think about it. You solve the problem with minimal effort, and then you're controlling the side effect with something that is not a drug. It's just a spice. You know, that is certainly ruining the established system of pumping you with drugs. Think about that. You know, and
absolutely. When the first time I went to see my doctor when I came back, the first question I told him that I'd gone for alternative treatment, and he just looked at me, and the only question he had for me was, what did that cost you? And I was in shock. He didn't ask if it was laser, he didn't care. I was really, really shocked at the reaction that I got from a lot of people. What did that cost me? It's like, what did it give me? It gave me my life. I would have sold my house if I had to, and I'd do it again. In a heartbeat.
But see, that's the thing. The price isn't really that bad.
The price is great. It's nothing. I mean, no, it was great.
Listen, we got another commercial break coming up, so we'll continue after, okay?
Alrighty.
Okay, we're back from the break again, and Sylvie is still with us, and besides telling you to take a lot of turmeric after coming, well, you know, she had other suggestions, but what I was wondering is her thought about if she had listened to the scary, even after her treatment, if she had listened to what they told her and how they were scary, what she think would have happened to her. So I want to see her insight on that.
Okay, I've had a few thoughts on that. Honestly, I don't really spend a lot of time dwelling on that, but yes, definitely it crosses my mind every once in a while. And I have to say that it's certainly not a pleasant thought, but from what I've seen around me, I think people end up going, well, first of all, you go through some kind of a depression. You go through surgery. I'm really not sure what the recuperation period is for that, and the chemo and radiation, and I don't know, being sick all the time and weak, and having the chemo kill the good cells as well as the bad cells, and the radiation is just it's more than I can even imagine.